Good evening, Khushamdeed. Namaste. My name is Dr. Vinny Kantru, and I'm a pulmonologist and critical care physician in the Indraprasth Apollo Hospitals, New Delhi. Today, with another interesting session, we are meeting here on the Dr. KK's Med Talks non-stop show. Today is the 1015th episode. Yes, you heard it right, 1015th episode. And every Thursday I come here with you to discuss very, very interesting medical topics to increase the medical knowledge of each and every one of us and gain some insights into newer topics. So let's not waste any more time and go directly to the headlines of the day. आज के headlines of the day. 45% of Indians have been found to be unhealthy. This is almost half of the population, a whopping 140 crores, 45% being unhealthy in the latest India Fit survey report. This is a very, very large and huge number. What are the solutions? We will be following our discussion with that and more. A recent clinical screening for lifestyle diseases revealed 18.14% of the people at high risk of developing lifestyle related diseases. Research suggests lifestyle disorders start early in men. इस चीज़ में भी कोई दो राहें नहीं है कि लाइफस्टाइल डिजीज़ जिसमें डायबिटीज़ एक बहुत ही कॉमन डिजीज़ है. डायबिटीज़ इज़ अ वेरी वेरी कॉमन डिजीज़ when we consider lifestyle diseases, and India is the capital of diabetes, and we all know that all these diseases as well as the cardiac illnesses, especially the cardiovascular related diseases start a decade earlier in the Indian population, especially men. So this has been seen and observed in the studies. Also to fix up your metabolic health, now newer studies are focusing on the gut health. If your gut health is proper, lifestyle diseases related management can be easier. So even if you think of Ayurveda and ancient science associated with the Indian continent, which was there previously, our texts do mention that gut health is very, very important as far as the lifestyle diseases are concerned. Apollo Hospitals launches India's first pediatric health assessment on chronic lifestyle related diseases in children, which is a very, very welcome step because it is there. We can just nip the bud in the making, where it starts off in children when they have problems which start in very, very early childhood, which can lead to problems later in life, which can lead to certain kind of lifestyle diseases. So now let's go to the topic of the day. आज के हमारे टॉपिक पे चलते हैं. जैसे हमने बात की लाइफस्टाइल से रिलेटेड डिजीजेस की, आज का हमारा जो टॉपिक है दैट इज लाइफस्टाइल काउंसलिंग एंड प्रिवेंशन. इट इज़ वेरी वेरी इंपॉर्टेंट. सो वी विल बी फोकसिंग ऑन द सॉल्यूशंस, एंड आई फील वेरी वेरी प्राउड to introduce my today's guest, Dr. T.N. Ravi Shankar ji.
Good evening.
Welcome, sir, and namaste.
Namaste. Thank you for the opportunity. Thank you.
So we are discussing about lifestyle related diseases today, and to give an introduction about Dr. T.N. Ravi Shankar ji, he's a distinguished family physician at Sudha Hospital in Chennai with an impressive educational background that includes an MBBS, DFM Colombo, FCGP, PGDMLE, and an MBA. Dr. Ravi Shankar brings a wealth of knowledge and experience in his practice. His commitment to providing comprehensive and compassionate care has earned him a respected reputation not only amongst his patients but also amongst his peers. At Sudhar Hospital, Dr. Ravi Shankar is dedicated to ensuring the health and well-being of families, leveraging his extensive training and expertise to deliver exceptional medical care. Thank you so much, sir, for sparing your valuable time today for us.
Thank you.
So, if we talk about lifestyle related diseases, what are the various lifestyle diseases which commonly come into the picture, especially if we think about the Indian population at large?
Of course, India is the capital of the world for diabetes, the first major lifestyle diseases. Then you have your hypertension, two of the major problems that in the country. And as a family physician, we often see these two diseases in the family running one after another. With almost 4 decades of practice, I am seeing the second generation of people, in spite of the counseling, in spite of the lifestyle changes that we always advocate. uh, Being in such a big hospital yourself, I think you will also know today, changing in the lifestyle right from the childhood is of course necessary to make a person be away from the ailment that they could suffer because of the genetic inheritance. Hypertension and diabetes are the two major problems in this country, an economic burden for the family and to the country also. I think we need to take a lot into the society to counsel and make a lifestyle changes for a better, productive national citizens in this country.
Definitely, sir. As you rightly spoke about where to nip the bud, actually. So, children are something we should be focusing all our energies on, because it is there that the psychology of overeating also starts, because that is something which is very very detrimental. And if we keep overeating, metabolic syndrome and many number of lifestyle diseases are related to it. So, when we talk about the solutions related to lifestyle diseases, what are the common things which come to our mind in form of solution?
You have already told about overeating. There's another habit that develops over the time of from teenage onwards, and when you're getting that independency in your life. Alcohol and smoking are two major concerns in anybody's life, and that is in the society. Being exposed and getting the freedom when you are in the teenage, and you get the option of getting away from your parental clutches. I think the people started trying to try it and then get involved in it and then addicted to it, and they spend a lifetime getting all the ailments, and then after that very late trying to recourse, trying to find a solution. But lifestyle modification, lifestyle diseases well known, and now we need to take it right from the school children to educate them on the two major hazards, smoking and alcohol. Two very difficult situations. Somewhere somebody gives a chances even without your smoking, you are exposed to so much of fumes and allergens and all these things. That itself is going to create a lot of problem for your lung. And you also have an inherited complication sometime of a chronic bronchitis running in the family, respiratory ailment running in the family. There is a chance of the child getting it in the adulthood or a little late in the adulthood. All these things will have to be assessed. That is why I said right from childhood, if there is going to be a prone to be getting some inherited respiratory problem, then you need to start them on the lifestyle changes, on how they have to get mingled in the society. There are a lot of non-medical management, your respiratory exercise, your yoga, all these things are going to be helpful for these children not to get into the ailment that they are supposed to get it genetically. These are major things that can definitely make a person much better, a quality life in the later stages. Lifestyle is one of the major concerns right now. When we talked about vaccinations earlier, preventing the ailment, today we are talking about lifestyle changes. Lifestyle changes most often involves about your dietary habits, your avoidance to alcohol, your restriction on alcohol, your leverage that you don't take at all, smoking and all these things. Your lifestyle is definitely going to give a better life for you.
So, we spoke about smoking. When we think about smoking, and there are various surveys which have happened in our country, especially the 2017 survey, and before that it was, I think, in 2014. It was seen a large population of adolescents has started smoking, which was a whooping number which is getting higher and higher. So, how do we counsel this age group particularly to refrain from smoking? So, what are the measures which we can take as doctors to prevent these children from going into this constant habit of smoking?
Yeah, we need to target the school children right away from school children. Even when they are doing their first to fifth standard, we need to teach them about the pollution. We need to teach them about the fumes that can always harm heart to us. Somebody, if they see the lung of a chronic bronchitis or a COPD patient and a normal lung, we need to expose them to the anatomy and the physiology that keeps changing right from the seventh standard to that plus one or a plus two, whatever it is, they are exposed to science. They will know things. Only if they see a lung which has chronic bronchitis due to smoking, and only when they see a lung with a COPD with such a big difference, then only they will understand what they are doing to the human system. The system such as most complicated computer ever that can be produced in the world is a human system, which accommodates, which tolerates the abuse that you give it to the system. In spite of it, after 10, 15 years, somebody who smokes, the exposure to the children to the real anatomy of these organs can definitely make a big change. Also, it's not the lung alone. I think your entire system of heart, the entire vascular system is also going to get into trouble. It's not the lung alone when you smoke. Because of that smoke, it can cause all the problem in your vascular system, thereby into the heart also. The children should be exposed even before they leave the school on the anatomical changes that can happen into your system. See, you take care of your face so beautifully. Whatever time you get up, you want your face to look so nice and beautiful. You wash your face, do all the creaming and all the powder. When you do it externally, you need it be done internally also. And what need not be done is that smoking causing that amount of damage to your anatomy, that is the lung, and also the physiology of the lung that can happen. I think we need to expose the children directly on these issues. Only when they are exposed, only when they see to themselves, only if they are exposed to somebody in their home who keeps smoking, because of smoking they land into trouble. Midnight, they need to go in search of a hospital to keep some oxygen or some medication. Only if they see the difficulty of these person and the hazards that can disturb the home, then only they can experience it within themselves and then avoid all these pollutions and all these smoking and alcohol also. Unless you are really exposed, unless we are really exposed to the anatomy and physiology that can happen in your system with all the smoking abuse, it's not easy to go into their mind. We have already thought about them how smoking can cause problem in themselves. But unless they see to themselves, they should not suffer and then change. They should see in the others and then try to change. Making them suffer and then change, it's not the purpose of the medical community or the society. You need to educate them much earlier, make them understand what are the changes that can happen in your system. A largely a productive personality at the age of 35, 40s, getting handicapped because of the dyspnea and thereby not able to function or earn properly, neither to the family nor to the country. It is going to harm everybody in the society. It should be taught to them. Should be they should be exposed to all these things.
Right, sir. So, when we think about sitting, it is now said that sitting is the new smoking. So, it is something which is also causing a lot of our lifestyle related diseases. So, what about this sitting? Why are we talking about this sitting and that too comparing it to smoking? And what can be
Okay.
done regarding that?
It's very simple. Don't sit. Keep working. Keep walking. Keep doing exercise. I think the young age we need to make them. Today, with things have changed and everybody has been glued to the computers, glued to the mobile phones, that they don't go about doing exercise. There used to be a 1 hour or 45 minutes of compulsory physical education in the school. I think which is slowly coming down. The schools are now don't even have their own playgrounds. They need to depend on somewhere else. They take the children out for some time, only on few days in a month to do all this physical exercise. But then today, yoga is something part of this country. It need to be taught. When you think yoga, I think every day in the morning when you have a prayer in the school or in the college or whatever it is, that's a time when you can spend 5 or 10 minutes trying to teach all the children about yoga and the value of exercise in their life. It's not walking for the children, it is active exercise for the children, aerobic exercise. All these things will have to be taught again and again. A system which is sitting in the computer for months together, for hours together, is the one which is a cause of the metabolic syndrome. I think that and every children wants to be a top person working on the computer. And if they want to be a top person working on the computer, their mind also will have to work. It is not that sitting in front of your computers and trying to think make things cannot happen on their own. You need to make your entire system function. When you want to make your entire system function, you need to have a blood supply to the entire all the organs, which cannot happen when you are sitting alone. When you need to exercise a lot to make the blood flow in the normal phase, in an exaggerated phase to all the organs, so that your brain gets a good amount of blood, good amount of fresh blood, so that you are able to work much better and concentrate much better. This is where the metabolic syndrome has happened, and sitting is also now a link to the smoking or even to your alcohol or whatever it is. Making a person lazy can always make its life worse and bad.
Right, sir. We have many people who have joined us to listen to this session. We have Aruna Tyagi ji, we have Ali Nazakat ji, and we have Rameshwar Pal Singh Panwar ji. Good evening to all of you from our end. Also, they are expressing joy that they are able to listen to this session today, which is very very interesting. And we are discussing lifestyle related diseases and counseling, how it can help these lifestyle related issues. We spoke about the smoking, we spoke about hypertension, we spoke about diabetes, we spoke about certain issues in children which come up, especially in the adolescent age group, and sitting, how it affects our metabolism and leads to something called metabolic syndrome. So, apart from these, what are the other lifestyle related issues which can arise in people, especially in our subcontinent?
No, you land up with your hypertension, you land up with your diabetes. Next comes your cholesterol. Next comes your cardiac ailment. Somebody with both these ailments, if they don't have it controlled with your medication or with your lifestyle, I think there is going to be a lot of changes that can happen within your cardiac system and resulting in a cardiac problem. When one organ gets damaged, either your lung or your heart or your pancreas is not able to produce the enough amount of insulin to metabolize the carbohydrates what you take, I think it is going to spread to all the organs. That is how your eye is also going to get damaged. Your liver is in trouble. Your kidneys are in trouble. Your brain is also in trouble. One organ in trouble can precipitate over the course of time all the organs into trouble. And then when all these organs are going to be in trouble, the man's ability or the person's ability to cope up with the day-to-day life is also going to be in trouble. And he is not going to be a person who's needed in the society with the productive for the family or for the country. This is a major chunk. One organ, one ailment, putting a burden on the other organs, and so you are not able to be able to function in proper, or not able to do the proper appropriate work. Somebody who dies at 60, it is called it's an internationally known that by the age of 58, 60, your system gets fatigued and you need to have some amount of rest. That is why you retire. But these kind of people retire much earlier, maybe a decade or so earlier, and their productivity goes away. There are people who live up to 80, 90 with all the productivity, all the mental function so perfectly, all because their lifestyle they maintain. They have given importance to the organ that is there. They have taken enough amount of exercise. They have given the required amount of physical energy that has to be consumed for the food that they take, and that has resulted in a longer lifespan. More than that, your eating habits is another big one. You frequently take short or a fast meal. That's another big issue in the country right now. With a fast paced life, you take a quick meal and you take often a meal. or sometimes you skip a meal too often. All these things are resulted in a complication. And skipping a meal, not taking food too long, or not taking too spicy can harm the intestinal tract. And this harm is not only going to have your bowel disturbed, it is one of the precipitating factor for a malignancy in your stomach and the GI tract, or even the large bowel if you have a long-standing complication. The major cause of a carcinoma colon is overweight, and we can always imagine that metabolic syndrome, people with overweight, can also result in such a complication. A non-communicable disease goes into the stage of a malignancy, can happen with not giving the appropriate exercise to your muscle, not making your organs function properly with a good amount of blood supply that needs to be. All we need is not 24 hours of physical work. It only needs a 30 minutes or 45 minutes of daily dedicated time to be spent on the organ and on the muscles that you have.
Right. So, one of the questions which has come up, which is an interesting question, is from Reshma, and she wants to ask, nowadays, children are burdened due to competitive exams and studies, which they have to spend hours on, and they don't have time to do exercise. So, how should this be tackled?
That's not an excuse. I think competitive exams will be there. It's the whole problem is the parents when they're not able to achieve certain things in their life, they try to push it on the children to do it. That is where the problem arises. You allow a child to think about what they want to do, how they want to do it. You ask them to go to school, come back, ask them to go for a sports, or in the morning go for a karate, and then weekly 3 days you go for a cultural training of Bharatanatyam or dance, all these things. I don't think a child can do everything. If they are focused on sports, let them focus on sports alone. If they are focused on cultural activities, let them focus on. You can't have a mixture of anything. The mixture of everything will happen in the age of 25, 30s. Learning can happen at any time in your life. Even at 60, 70, there are people who learn, who have mastered the art of sports. But then when you have time, you have to spend time on your education. That's the first priority. There should be time for your children's interest. Either it is going to be culture or it is going to be sports or something like that, or learning or something different. Allow them to have their natural time in the evening for that, and then allow them to study, read, or whatever it is. Don't push everybody on a competitive phase. Let them learn in the learning phase. Somebody who learns does a better performance in a competitive exam. You just can't infuse a knowledge, infuse a subject into a person to vomit out in an exam. They learn it in their own way, they learn it in the natural way, along with a recreation, the choice of theirs, culture or sports or whatever it is. Then they learn it much better, and they always excel in the competitive exam. It is not that sitting and reading morning 3:30, 4 o'clock, they get up, they read up to 6 o'clock, then rush to the school or rush to the college, come back in the evening, go for all these things. The brain is fatigued, the physical system is fatigued, and their concentration is poor, and they will not be able to learn. Even if they learn, they will not be able to reproduce it in the competitive exam. Competitive exam today are not trying to vomit what they have learned. It is trying to find out what is the ability of you to analyze and get things solved. That is how most of the competitive exams are there. So let the parents think around, not putting the book in front of them, putting the life in front of them, the life of smartness, the life of how you choose, analyze things in your life, and that will be the best way to give them the education, and that is how they keep winning in the competitive exams.
Right. Puneet Kumar Yadav is with us. He wants to ask something about symptomatic myocardial bridge and what to do for symptomatic myocardial bridge.
When you are getting a symptomatic myocardial issues or something like that, we keep talking and somebody is saying that I always have a cardiac issue. That gets focused on the individual. I think if they are having something in their mind, it needs to be relieved by an appropriate investigation and trying to convince them that they don't have any of these issues. Unless you prove it to them black and white. Today, medicine is a scientific evidence based. You feel that you have a cardiac problem, you feel you've got a kidney problem, you feel you have a visual problem, then do the necessary investigation. It doesn't mean that investigation should be a positive. The investigations that you do for certain ailments which you have in your mind should always be negative, so that it gives a confidence in you to go about and do your normal work again with all the confidence in your life. It's a science, evidence based science. When the person has got something in their mind, I think you got to clear the mind in the first choice to make them back to be functioning normally.
So, since we spoke something about prevention or to just to know your body, are these health checkups, which are available in many number of hospitals these days, are they recommended? Who should get these health checkups done, and at what frequency should they be done? Once a year, twice a year, or it should be every 2 years? What is the guideline which guides us?
I'm not sure about the guideline, but one thing I'm very sure, if there is a genetic family history of hypertension and diabetes, I think right from the teenage 20s, 18s, and 20s, you need to do at least once a year or once in 2 years if the person is perfectly normal. That's the age when you start becoming busy in your life. You're going for work, you have a lot of things to manage, and then I think definitely at least once a year you need to go about doing a test. Regular test analysis on your sugars, on your kidney function, or your cholesterol, ECG, echocardiogram, all these things are necessary at least once a year when you cross the 30, 35s, and more so for people who have a family history of hypertension, diabetes, obesity, and all these things. And if you get hold of either of those 32 things, smoking or alcohol, I think you need to do quite frequently. Yes, if you do 10 times, if you do for 10 years, 10 times, it may be normal. You should not get dejected. You should feel happy that it is normal. 11th year, 12th year, you might get some changes in your life. It is all because of the changes that happen in your day-to-day life. It's not smoking and alcohol alone. The stress that may have, you need to know to stress burst yourself. And if you're not able to do that, that is going to affect the entire system. If you are able to burst your stress with your friends, family, and everything, it's going to be good. But then certain people will be able to do it. Certain people are introverts who keep it within themselves, and these people are prone for all these things. And 11th year, 12th year, you please do it. You please continue to do it. And one point of time, there may be a problem, or you may be detected in the pre-diabetic stage or a pre-hypertensive stage, and then you can put in more of lifestyle modification. You can still make your life changes, and that is how it needs to do. I'm not the right person to talk on the protocols of all these things, but then a yearly annual checkup is absolutely necessary. They might keep talking that this is not going to be useful, non-productive, but then at the end of the 15th year, at the end of the 20th year, you will know the value of the investigation that you have been doing every year. You detect it in a pre-stage, modify, live a life without medication with all your lifestyle changes.
Right, sir. Are there any female specific tests which should be done? Because females are the one which often ignore their health to the last stages, and they don't get themselves checked. They remain busy, and this is especially so about the housewife, which are who are very busy during the day. They keep working all day, and then don't get their health checkups done. What are the tests which are recommended for females?
Again, all the checkup that is done for the men also has to be done, except the PSA. In front of the PSA, we are going to do it something on the cervical cancer, and for the teaching them on the breast malignancy, how to do a self examination of the breast. At least if there is a family history of breast malignancy, definitely at least yearly mammogram once they reach the age of 40, or at least if there is no family history, once in 2 years or 3 years, you need to do a mammogram. A self examination of the breast is very much needed. More important, the woman in the middle age and when they are about menopause, there are bleeding disorders causing anemia. Still in this country, we do see people, women with anemia in the age, either in the younger age group or at the age when they are in the 40s and 50s. I think that's the most avoidable ailment that a woman can have in this country, and that has to be taken care. An ultrasound of the abdomen is absolutely needed, and that too after a menopause. If they have a bleeding disorder, if they have a difference in their lower abdomen, they need to do an ultrasound abdomen once, even after menopause. They always feel once the menopause is over, nothing is going to happen to them for the uterus or the cervix. It can still happen for them in an active life. and they need to follow it up also even after the menopause with an ultrasound at least once in a year or once in 2 years, so that they pick up any changes earlier and give the appropriate treatment. Today, malignancy has been conquered in so many organs. The same way that can happen, early detection, total cure, and you live a normal quality life.
Right, so very, very important that we take care of these things, especially the females who have to take care that they are getting the appropriate tests in the appropriate age. So, when we talk about prevention of lifestyle diseases, what are the things which come to our mind?
First is your exercise, dietary changes. These are the two major things that can do, and plus stress. How you can overcome your stress. There are things that you can take up in your life. There are things which you can't take up in your life. Everybody is not tuned to take up all the issues, all the workload and anything. You should be able to introspect yourself, analyze yourself, what is your capacity, and don't overdo or overtake the burden of the work and life. Whatever you do it with success. Once you get that success, go to the next stage and do it. Stress is another major factor in this fast day life that can cause so much of problem into your system with so much of adrenaline secretion that can harm your heart, that can cause problem into your pancreas, and that can also cause problem into your liver, and all these things can put a person in total jeopardy. So food, exercise, stress, three major things. Additionally, avoid alcohol and avoid smoking are the major things that lifestyle changes that need to happen. Anything else, madam, from your side? You should do.
Very well, sir. There's a question from Reshma. She wants to ask, can cancer ovary happen after menopause?
Yes, there have been happening cases. There are cases that are picked up even after menopause with the malignancy in the uterus or in the cervix. That can do happen. These are things that we need to pick up earlier. Even during when they are menstruating, there would have been small signs or symptoms which have not been taken care of, ignored. Cancer doesn't come overnight and grows within overnight. It takes some time, and all these things can still happen even after a menopause. We have seen cases who had come with malignancy in the uterine. All these things would have happened much earlier, but exhibited quite late in their life. That is why the regular ultrasound, the pap smear study is needed for a woman to come out of all these stretches.
Right, sir. Anything you want to share about your experience of lifestyle diseases or anything in particular, sir?
Indian population have still not realized the value of exercise and dietary habits. The young are abusing their diet. The old are not coming forward to do a regular walking or exercise. We keep seeing it everything on your social media, on your satellite TV. Keep talking everything. We keep talking, but still the 100% of the Indian population have not come to that extent. If your diet and if your physical activity are done in the extremes of age so well managed, I think you will live a beautiful life, more productive for yourself, for your family, and for the country also. Exercise, walking, diet, and avoidance of alcohol and smoking, and how to relieve your stress is how a man is successful in his lifetime.
Right, sir. Very well said. Stress management, the mental health also is very, very important. And about the physical health, we have yoga, International Yoga Day tomorrow, the 21st
Tomorrow.
of June. So I urge each and every one of you at your home only, if you can switch on your TVs and see certain asanas and get up in the morning and just flow with the rhythm of yoga in the morning, you'll see how much difference it creates in terms of the physical health as well as the mental health, which is very, very important. So, Dr. Ravi Shankar sir, we are very, very thankful to you for sparing your valuable time with us and giving us a very important insight regarding the lifestyle diseases and their prevention. Thank you so much. I'll ask my colleague Shriyan to show a small token of appreciation, the certificate for attending this session today here with us. So before we end this session, we have a question which has come up just now. So this is the last question which I'm going to take up, which is the best way to combat stress and which is which is so very common these days.
They always say about meditation, your yoga is also going to be helpful. And you need to spend some time all alone sitting and trying to meditate. You need to know what is your capacity and take and don't take anything more than that capacity. You can always convince your colleagues, you can always convince the place where you're working, this is the amount I can work now. I'll take the next set of work a little later. You don't make your self system to work more. Don't make your brain to function too much. At one point of time, only a person can do only one work at one point of time. If you complete that successfully, go to the next phase of the doing. In fact, I wanted to add one more thing. You take care of your mobile phones. You take care of your car so well. Somebody who doesn't take the car for 3 days will always find in the morning trying to put it on, make the battery charged up, and do all these things, but they don't do it for their own system. If they start the car in the morning and then go for a walk, then it keeps both your car and yourself perfectly normal. And relieving of your stress is an individual's capacity. And if you don't know to do that, try to follow somebody who is advising you how to relieve your stress. Meditation is one of the things. Keep yourself quiet in a room for 5-10 minutes in a day. Definitely, you will know the difference over the course of time. Keeping your mind free, not sitting alone and trying to think something, keeping your mind free. That is relieving your mind, your brain tissues, your brain neurons not to function. Keeping it quiet for 10 minutes or 15 minutes a day is definitely going to refresh it and make you do a better job. You always try to find a solution. Every problem has got a solution, and that solution will be thought over slowly and addressed and followed and acted over it. And that is how you can relieve your stress. Your stress is all because the problem in your family, the inability to cope up with your employees, and how you manage your friends and all these things. Every problem has got a solution. Think slowly and think with confidence. You will be able to overcome your stress.
Thank you so much, sir, for all these insights. And we wish you a very, very happy International Yoga Day. With this, we end this session today. Jai Hind and Namaste to all of you.
Thank you. Namaste.